Hi! Today we're going to talk about understanding type 2 diabetes. We're going to talk about the disease process. Before we start that, I would like to share a personal story with you guys. Before I became a physician, I was a registered nurse, and I worked mostly with diabetic patients, especially the last 10 years of working as a registered nurse. And diabetes, the teaching diabetes is near and dear to my heart because I saw with the proper teaching and tools that I gave diabetic patients that they became empowered to use these tools and turn their lives around. They decrease their blood sugars by being active with their diet and exercise and natural supplements. Those blood sugars, as they were reduced, their signs and symptoms started going away. So this is very near and dear to my heart because people can become empowered to turn this disease process around. I have seen people lower their insulin that they were taking. I have seen people get off of medication or lower their oral medication. And some people aren't even on medication and their blood sugars are turned within the normal ranges. So it depends on where your body is, how much your pancreas gland is releasing, how much insulin, and if you're insulin resistant, and we're going to talk about all that in just a minute. And it depends on your personal choices. How far do you want to go with this? We're going to give you some tools here, some information. It's going to be very powerful. You will have this information in your hands now, and then you can make your personal choices on how far you want to go with this. So let's talk about what's going on inside of our bodies at a cellular level. When I show this chart, this poster to patients that come in my office, they usually have an aha moment. It's like, Dr. Marcantel, is that what's going on inside of my body? And I say, yes, let's talk about it. So here's our pancreas gland. All right, the pancreas gland is located in the left upper quadrant of the abdomen. All right, so what happens is this pancreas gland is responding with the release of insulin every time we eat carbohydrates and sugars and such. The pancreas gland releases these insulin molecules, okay? Let me just say a side note about the pancreas gland. The pancreas gland is amazing. It does so many different things. But for the sake of talking about diabetes and insulin, we're just going to talk about the pancreas gland releasing insulin today. So, releases these insulin molecules, all right? And what happens is the insulin is released in response to a rise in blood glucose levels. Now, when I say glucose levels, I mean blood sugar. Okay, so the pancreas gland releases insulin, all right? And in type 2 diabetes, problems occur when the insulin that is produced doesn't work, or when the body cells resist the insulin. So here we have the release of the insulin molecules. This is representation of a blood vessel, and we have the insulin molecules coming down. This is the normal, this is representing a cell right here. This is the normal body cell on this side, and this side is representation of the body cell with diabetes. So what normally happens is we have these little areas right here called receptor sites on the cell. They're like little doors that open up to allow glucose in here in the cell, and that glucose is converted to energy. Okay, so when people come to me, that's one of the first things I ask is, what is your energy like? Okay, because if you're not getting that blood sugar, that glucose into the cell, okay, it's not getting into the cell, so you're not going to have energy, and you're going to feel really tired. All right, so that's one of the signs here. So back to the insulin. Let's talk about a little story here. So let's look at insulin as the gentleman that opens up the cell doors to allow the lady glucose into the cell. Okay, so that's what insulin does, and that's why it's so important to come from the pancreas gland to open up these cell doors to allow that lady glucose into the cells to convert that glucose into energy. All right, now, if we have a scenario here where these doors, these cell doors, these receptor sites are closed off, we cannot get the glucose molecule into the cell. We have an energy deprived cell right here, okay? So the person's tired. So what happens is there's could be a couple of things going on. One is we're not getting enough insulin produced by the pancreas to open up these cell doors to allow the lady glucose into the cells. The other thing that could be going on is there is what's called insulin resistance, in which there's been so much insulin produced by the pancreas in response to so many carbohydrates and sugars coming in that we eat, that what happens is there's so much insulin knocking at these doors all the time that the doors start shutting down. The receptor sites no longer receive no longer open the door that when the insulin knocks on the door to open these up for glucose. So these are shut down, these doors, and the glucose goes into the blood, okay? So we start having a lot of glucose molecules here into the blood, all right? And it starts affecting our circulation. Thus, here comes the problems, the signs and symptoms of diabetes. So we have a situation here where the cell is starving in the Sea of Plenty. There's not enough glucose in the cell, but plenty in the blood. Without proper management, long-term diabetes can damage many parts of the body, such as the eyes, mouth, cardiovascular system, kidneys, even the hands and feet, and affect the nerves. So we're going to briefly go over a few complications that can happen with sustained blood sugars. One of the first things that's affected is the vision because of the tiny little vessels, and also the kidneys because of the tiny little vessels in the kidneys. So the smaller the vessels, the quicker they get blocked up with too much sugar. So people that go to the bathroom a lot, urinate a lot, you know, that's one of the symptoms we ask. And long term, and this has progressed pretty far down the road for most people, is dialysis, because they can no longer, their kidneys can no longer support them, so they need to get on dialysis. And then there is, as far as for eye disease, glaucoma, cataracts, diabetic retinopathy can happen to the eyes. So those are, I ask people when they come in, what's your vision like? You know, is it cloudy? Have you noticed a decrease in vision? Because the eyes will be one of the first things affected because of the small vessels and the kidneys as well. So those are some of the signs and symptoms, and long term they can, like we said, they can affect the eyes and the kidneys in more of a severe ways for long-term glucose levels that are high. The other thing is, vascular disease. Anywhere that there are blood vessels, which is all over the body, it can be affected. So heart disease and stroke, even nerve damage, neuropathy. Some people get asked when they come in, do you have tingling in your fingers or your toes? Then we know there may be some neuropathy going on. Sometimes this is reversible and sometimes it is irreversible, depending on the amount of time that the person has had elevated blood sugars. The other thing is that we want to be careful of and watch too is the periodontal disease. That's very important to keep. When the sugars are high, we want to keep the teeth clean because those high sugars can affect the health of the gums. One of the things that I used to do as a nurse was take care of diabetic sores. So I specialize in diabetic wound care. And why is it that it's important to check the bottoms of the feet in between the toes when you have high blood sugars? Because the feet are the farthest away from the heart. The heart is pumping the blood throughout the body. So the feet are farthest from the heart. And you're going to get less circulation there going on. So if a diabetic steps on a little pebble and gets a little sore there, it may take much longer to heal than the regular person. So I always instruct people to look at their feet in between their toes because a lot of times with neuropathy they can't feel very well and so they don't feel that little sore underneath there, and that sore can spread and it can get bigger because it's decreased circulation in that area. In other videos we'll be talking about foods to eat to balance our blood sugars, exercise, and other natural supplements that will cause the blood sugars to become more balanced in the body.